All right, you're noticing we're not in the studio, and that's because we are basically sheltering in place in Indiana. I shouldn't say basically, we are sheltering in place. Regardless, we're going to be taping from here right now, and we wanted to answer more of your questions because we know how much you want to hear answers. That's the topic of this week's Healthcare Triage. Let's jump right in. I'm going to try to be as succinct as possible because we want to get to as many of these as we can. So, first up, last episode we talked about how the fact that the virus is not airborne and that we don't have studies to say how long it remains in surfaces. And then a lot of you chimed in the next few days to say, now there's this New England Journal of Medicine study that notes it can remain airborne for up to 3 hours, and the amount of time it's on surfaces is much longer than we thought. And there was a report even on that cruise ship that they could detect virus for 17 days. Okay, so first of all, it's important to know that there's a difference between being able to detect viral DNA, which is what was happening on that cruise ship, it looks like, versus actual virus that could infect you. Those are two separate things. Like dead virus particles of RNA or DNA are not the same thing as live virus. Secondly, there's a difference between we can detect a particle in the air and there's enough to actually get you infected, or at least give you a reasonable likelihood of getting infected. Those are also different things. If this thing was truly airborne and could just go up and down a hallway, the R naught, or the rate of infectivity, would be much larger. And we're just not seeing that. So we have to also go by what we're seeing clinically and in the real world. And in that case, this doesn't appear to be something where it's airborne in the sense, again, of floating down a hallway. It can be aerosolized and attached to particles, so you can cough and sneeze it onto people, but that's a very different thing. Masks. Please explain the rationale behind the claim that masks are not effective at protecting the general public from the virus, but they are effective at protecting healthcare professionals. There is probably a greater than 0% chance that a mask could stop you from getting infected, in the sense that it's going to block something. But again, there's also real world in the sense of how much will a mask protect a healthy person just going out in the environment? And the answer there is it doesn't appear to be a great deal. On the other hand, a healthcare worker is in a dangerous environment where they are much more likely to be coughed on or sneezed on, or in getting a test, having it aerosolized. They are at higher risk. Therefore, they are protected. And they're also seeing contact after contact after contact, while many of us just in the general world are not. We're rarely coming into contact with someone who's infected. On the other hand, if you are infected, then it could stop you from coughing or sneezing or putting it into other people. But the bottom line at this point is also we have a massive shortage of protective personal equipment, especially for healthcare workers, and we need to get it to them because they're our frontline personnel. They need it the most. They're at most risk. If they get sick and can't help us, then we're all at risk. So most of the guidance on masks has not changed. And if you are sitting on a hoard or a bunch of N95 masks, you really ought to consider donating them to your local healthcare facility because they need them badly. So now we're going to talk about some myths to address, and these will be pretty quick because the answer is almost always going to be no. First up, using a hairdryer to heat up your sinuses can kill the disease. There's no evidence for that. I don't recommend doing it. Anyone younger than 40 will just have cold symptoms if they catch the virus. That's not true either. In fact, if you look at the news and look at the rates of people getting tested and being hospitalized or even getting really sick with this, a significant number of people still between the years of 18 and 60 are being hospitalized and getting sick. This is not mild. People are more likely to die in higher age groups, especially like the 75 or 80 plus groups. But the chance of getting really ill is not insignificant in any age group. We should all be very careful about this. Drinking hot water regularly and avoiding eating or drinking cold things will help you avoid the virus because hot water washes it out of your mouth and throat. Yeah, there's no evidence for that whatsoever. Don't believe it. Staying inside for a prolonged period will weaken your immune system because you lose immunity to things you're typically exposed to outside. I mean, I guess over the course of years or decades that might be true, but we're talking reasonably short periods of time in the span of a human life. This is not something I'd be worried about right now. What we really need to be worried about right now is the crisis of COVID-19 and flattening the curve. So stay inside. I mean, you can go out and take a walk, but for the most part, socially distanced, physical distance, you want to stay inside your house as much as possible. Exercise and a good diet are all you need to avoid the virus. Exercise and a good diet are good things, and I encourage you to do them, but they will not help you avoid the virus. Everyone wants to know what the exit strategy is for social distancing. When is the curve flat enough to get back to normal? It's a great question, and we just don't know the answer. Part of it is because we don't have the data. My most recent piece of The Atlantic was talking specifically about this. We it's a bad question to say, when are we going to come out of this? And anyone giving you data is just pulling it out of the air. What we really need to be talking about is, what data do we need to know when we can come out of this? And the answer is, when it appears that fewer and fewer cases, pretty much low numbers of cases, are developing new every day, certainly being hospitalized or going to an ICU. And ideally, when we've done enough community testing to believe that there isn't a lot of community spread. I don't know the exact numbers. In fact, I'm trying to actually talk to some epidemiologists right now to find out, do we know what those numbers would look like? But we'd have to see, really be on the tail end of that curve, that the number of new cases would be decreasing drastically, not increasing or holding steady. And we'd need to believe that there's not a lot of asymptomatic spread out in the community that's just going to start this all over again. Won't the virus and all associated problems just come back as soon as we stop social distancing, or we have to keep things shut down until there's a vaccine? How did the Spanish flu go away? 3 great questions. It can come back if we exit too soon, meaning that there's still community spread and that there's a significant amount of disease out there. Then it will start all over again. But if we do a pretty good job of suppression, then it might be okay. Second, it would certainly help if we had enough widespread epidemiologic public testing to pick up hotspots and know. It would also help if we could set up a robust infrastructure to really jump on new cases, do tracking of contacts, and then know if we can actually catch even the asymptomatic people who might be out there. And if we can really lock them down, we can prevent outbreaks. A vaccine would help. Eventually, what happened with Spanish flu is that we developed herd immunity. Enough people were immune because they had either gotten sick or been exposed and then got over it, such that the virus really couldn't go through society much anymore. Vaccines are another way to get to herd immunity that is better because we don't have as many sick people. So one way or the other, we're likely at some point going to get to herd immunity. It would just be better not to have 40 to 70% of the human population get sick with this first. A vaccine would let us get to immunity sooner. How long is the current situation sustainable? Are politicians right that the cure is worse than the disease because we'll destroy the economy? 2 separate questions. Let's take the second one first. I don't think the cure is worse than the disease. And I think that the economy is going to be massively impacted no matter which way we go. If we let 40 to 70% of the American population get this, and that means 100 plus million people are sick, tens of millions of people likely in the hospital, and millions really ill, potentially hundreds of thousands dying, that's bad. Believe me, restaurants will not be packed. Planes will be empty because everyone will be panicked. No one will want to be outside, and we'll all still be in lockdown regardless. We'll just be there because we're absolutely fearful for our lives, not because we've been asked to do this for social distancing purposes. So I think it's a false trade-off to say that if we just let this run rampant, the economy will be fine. The economy will not be fine. Secondly, there's a massive economic cost to that many people dying and everything that would come from it, and not to mention the horrific human cost that would come from it. But as a question of how is this currently sustainable, Europe is a couple weeks ahead of us, and they're still doing this. We're likely going to be doing this for quite some time. I would guess, and you're getting a guess, weeks to months. I think most models that I've seen have this decreasing, perhaps, I don't know, if we do a good job, into Mayish, into June-ish. But again, it's less important to put a date on it than to know we're going to have to see a decrease in the rate of infections, really getting low, as well as some knowledge that maybe there isn't much community spread. If there hasn't been a request for the larger population to do social distancing, am I actually helping others by deciding to do it myself, or do we need to reach a certain number of people doing it before it's effective? Probably the latter. I mean, first of all, every little bit helps. So, decreasing risk is always good. We're never going to get to no risk, but the less risk we can have going around, the better. But we do need a decent chunk of people to be doing this. Basically, we're trying to achieve fake herd immunity. We're trying to prevent the virus from having somewhere to go. And as long as a decent number of people are out there socializing, the virus will have somewhere to go. And as long as it does, it's not going to disappear. And anytime we loosen our restrictions, it will leap back up again. So we really do need collective effort. We are all in this together. This week I went to get a takeaway coffee and snack from my favorite place where everyone was following the social distancing rules and doing the right thing. Later, my sister reamed me for taking a selfish, unnecessary risk, and that being more conservative than recommendations was more responsible. Is it better to be more extreme in my precautions? If people are sitting at the coffee shop, that's still not shelter in place. Now, granted, there are different restrictions in different environments, but ideally, we don't want to be eating and drinking in public places where we could all be spreading viruses. We want to be in our homes as much as humanly possible. Now, going out to pick up food can be very safe if you do it right. Having food delivered can be very safe if you do it right. But going to a place and hanging out, likely not so good. And so I think you're going to see more and more shelter in place rules where those kinds of interactions are going to be more and more restricted because it's very hard to be good in those kinds of communal environments. Is it wise to close college dorms where everyone has been breathing all over each other in close quarters, forcing students to travel all over the place, some back to family like grandparents that are at risk? Well, dorms are not ideal because you're all on top of each other, likely not eating in your rooms, but gathering communally to eat. And it's very hard in those kinds of environments to keep everybody safe, and the colleges don't want to have to manage that. So that is why most schools closed. Yes, that required everyone to travel, but we wanted to get that done while perhaps there was less disease in the community than more disease in the community, and every day there seems to be more and more. So travel will only get harder and harder as we move on. Yes, some people might have to go home and live with their grandparents, but once social isolation and rules are in place, the risk really only comes from within the house. So trying to minimize that risk before we had to lock everything down was best. But certainly, as much as we can, keep elderly people as isolated as possible from those who might be infected, the better. So there are trade offs, there's no question. As we talked about before, as I wrote about it in the New York Times, there are pluses and minuses to closing schools. It's just that it really seems that in this case, the benefits are going to outweigh the harms. If you got infected with COVID-19 and have recovered, can you assume now you are immune and thus not worry about social distancing? We don't know. Our best guess is that people are immune to this. We don't know how long it lasts, though, and we don't know when that immunity kicks in, and we don't know enough to say, like, yeah, go out and do your business. And to be honest with you, we're not conducting tests yet to know about immunity, to know whether that's the case. I'd like to think that in the future we will, and that will be a way perhaps to know that some people are even able to go out into roles that might be better served by people that we know are immune. We just don't have those data yet. Can you explain why I should be hopeful at all that anything that we are doing is making a difference? The math seems terrible. I'm pretty sure that we can delay incidence of infections, but completely unconvinced that we can reduce the total number. We've managed to contain diseases in the past, and we've done a good job, or at least a complete job, of dealing with pandemics in the past that did not lead to everybody getting the virus. This one is getting harder because, again, it's more infective than usual and it's more dangerous than usual, and we don't have any natural immunity or therapy. There's some, again, we do have evidence that this kind of stuff can work. You can look to Asia, where China and South Korea and Singapore have done a good initial job of really getting to suppression and forcing this thing down. Now, is that sustainable for the long run? Wait and see. But the more time we can buy until we can get a vaccine to get to herd immunity that way, the better, because then everybody doesn't have to get infected and lots of people don't have to get sick and lots of people don't have to die. All right, some questions about measures and precautions to take. As a food delivery driver, what precautions should I take to protect myself and my customers? I try to wait outside until I know I'm just running in for pickup. I know N95 masks aren't perfect, but should I be wearing one? Well, look, if you're coughing or sneezing or sick in any way, you should not be working. Once you are working, great hand washing, proper hygiene, making sure that you're not touching dirty things. And again, hand wash, hand wash, hand wash. Can't be said enough. Do all the things you should be doing, and then I'll, of course, try to touch as little of the packaging as possible and not the food. And that's better because then people can take what you bring them, and you could even leave it on the porch so that you don't have to physically interact with them. They can take it in, unpack it, throw everything away, wash their hands, then the inside stuff should be cleaner. So, there are ways to do this to truly minimize the risk to as low as possible. Is it safe to be receiving packages from places like Amazon? Should I be disinfecting the boxes as they come in? Again, same rules apply. What we do in our house is we bring the boxes in, we immediately open them, we take the stuff out, put it aside, throw those things away, and immediately wash our hands. Then, even if something, whatever, was on the box, we have cleaned it off. And if you put it down, you can wipe the surface down, but if you can do it without putting it down, so much the better. Everything's in the trash, our hands are washed, only the insides remain, we're better off. And again, the more you unpack at one time, the less likely you are to be touching your face or doing anything dangerous in the interim. How worried should I be about things I buy from the grocery store? Is there data on ingesting the virus when eating fruits or veggies? Other sources recommend wiping produce with a disinfectant wipe and perhaps packaged food as well. You don't need to go far at disinfecting stuff. I mean, again, first of all, packaging, wash your hands after you touch it. For fruits and veggies, wash them, but you should always be washing them. I mean, that's how we prevent, food contamination in general, which was a problem even before this virus existed. So yes, wash your food, your fresh food, before you eat it, as you always should. And be careful with packages, and just again, hand washing before you prep, hand washing after you prep, hand washing before you eat, hand washing after you eat. That's the best way to go. I've seen very different descriptions of cases from different sources, some that look nothing like the symptoms described by the CDC. What does it actually look like to get or have the virus? Are the symptoms different for everyone? For this virus, it seems to be the real things are cough, a non-productive cough, and fever, and not feeling well. If you have other symptoms or symptoms like those, you're never wrong in calling your healthcare professional to talk and ask questions, and that is what I recommend you do. Beyond symptoms, can you discuss things like how the virus progresses and how long standard mild severe cases might last? It ranges. It usually appears that people get sick between a couple days to up to 2 weeks after being infected. It looks like it can last about 2 weeks, but you could be shedding virus after that, so it's a range, and it differs. You should not be hearing, though, that when you hear mild, though, it's unfortunate because a lot of people think mild means nothing. Mild means you don't need oxygen in the hospital. You can still feel incredibly sick and not well and still be considered mild. So don't don't play this off as if it's nothing. It's a real thing. In the absence of a rapid test, can you rely on taking your temperature every day to indicate potential infection? Yeah, it's not a terrible way, but it's still not as good as testing. But it is a way that a bunch of other countries have used to do as a first level of screening, but that's only a first level. It is possible to still be infected and still be infecting other people and have no raised temperature at all, so it's imperfect. What's the fever range that is being seen with COVID? Is it different from standard fever definitions, 100.4 for adults? A lot of people think any slight increase, 99 degrees, for example, is a fever. We usually say 100.4 is the level. I think most fevers with COVID have been slightly higher, but that doesn't mean that 100.6 would not be concerning. I think sticking to the 100.4 level to call it a fever is reasonable. Are the reports of losing your smell and taste showing up as an early symptom of COVID-19 legitimate? Should we be telling people to look out for those symptoms? Not everybody has it, but enough people have it that it's become one of the other things you could look for. And certainly if you're experiencing those symptoms, I would talk to your healthcare provider. If you're exposed to a higher viral load at the onset of infection of COVID, will you have a faster onset and more severe symptoms regardless of age or underlying condition? So we're not doing randomized controlled trials to know whether this is true, but it seems reasonable. And so it's one of the reasons I think probably healthcare providers may be at higher risk. If I'm wrong about this, I apologize, but I think that that's the case. How are asymptomatic people able to spread the virus? Just by talking, just by touching things that other people touch. So the roots are either that it's on their hands, either because they've touched their face or their mouth, or because this is also spread fecal oral and they didn't wash their hands well enough after they went to the bathroom. And if it's on your hands, even if you're asymptomatic, you can touch stuff, give it to other people, shake their hand, do whatever. They're less likely, of course, to cough and sneeze on you, but that's only one of the ways it can be spread. Should I be worried about cuts or cracks on my hands, or can the virus only be contracted via breathing it in or otherwise getting in my nose, mouth, or eyes? This seems to be a respiratory virus, so most of it seems to be going in the mouth. I don't think I've heard of anything of people transmitting it like any other way, whether it be like sexually or by blood or anything else. So it seems a respiratory virus. Do you think the burden of disease will be spread throughout the country, or will it be more localized in specific cities or states like New York and Seattle? Well, at the moment, that's where we're seeing it spread. And of course, there's more density there and more people there. So it's going to be seen first there. But I think eventually the way this is panning out, if you look at the maps, many areas of the country could be affected. And of course, rural areas while they're more spread out, don't have as many healthcare resources. Hospitals have been shutting down. They don't have as many ICUs. So that could be a real issue as we move forward. Can clothing be a transmission vector for the virus? Should we be doing laundry more, changing clothes after we've been to the store? It's not a terrible idea because, of course, it's harder to disinfect. So not going to the store is best, but if you do go to the store, coming home and taking off your jacket and changing your clothes, no one's going to fault you. Better to be safe. What temperature or time period combination can kill COVID-19? Can I put something potentially contaminated in my car in the hot sun, approximately 140 degrees Fahrenheit for an afternoon and kill it? How about putting something in the warm oven? None of this is proven. I would not use heat like in this way as a disinfectant. Is the virus mutating? We think so. And of course, mutations are happening all the time. The question is twofold. One, will it mutate in such a way that it changes its lethality or infectivity. We're not seeing a lot of that yet. And the second bigger concern, of course, is that in mutating in such a way that it can evade immunity. We don't know, and we have no evidence for that yet either, but that'd be the big concern. What's the difference between SARS and COVID-19? The reported R0 is about the same. SARS had a higher mortality rate, so why is this so much worse? So I actually am not sure that SARS was as infective. I think it might have been less infective, but more importantly, I don't think there was much asymptomatic spread, so it was easier, nor like such a long window perhaps in how long people could be walking around and spreading it. So it was easier to contain. It was easier to identify, to isolate, and contain than this virus. I train at a small private gym at off hours. There are only 3 to 4 people there at a time. The space is large enough to maintain recommended distancing, so is it reasonable to keep going? I think that, recommendations would say no, because you're just putting yourself out there and exposing yourself. Lots of people are learning how to work out online using Zoom as much as possible. I would do that. If everyone sort of does these small little things, we're not really social distancing. My wife and my daughter are upstairs as I tape this, working out using Zoom, I think, and an iPad. And my wife loves going to her place to work out. What are your thoughts on the safety of playing tennis on public courts? With proper social distancing and staying away from each other, in ideal situations, you're probably fine. The problem is that it's a slippery slope. And are you being really careful till you get there? Are you really not socializing? Are you being careful to keep everything clean and wash your hands regularly? Are you making sure not to get together at the net and talk to each other? If you do everything perfectly, you're probably fine. My daughter and a friend went running in our neighborhood. They maintained a big distance apart. That's probably fine. But you want to keep all of that to as little as possible. Schools are closed in my area, but daycares remain open. Should my preschooler still attend daycare? So I think it's very unlikely that your daycare will remain open for long. It's likely that these are all going to be shutting down. The answer is no. Probably, there's fecal oral spread even amongst preschoolers, and that's a nightmare scenario for actual spread of disease. It's also putting the workers at risk. Who knows who they live with? So probably those should be closed just as schools are. Hey, if you like these, we're going to keep making more of them. And so here's a link to another video of questions that you might enjoy. And of course, it always helps if you like and subscribe and really spread the word about these videos. And more than ever, if you can go to patreon.com/healthcaretriage and support the show, that's what allows us to keep doing stuff like this. And we're trying our best, even in these situations, to get you the information you need. We'd especially like to thank our research associate, Joe Sevitz, and of course, our Surgeon Admiral Sam.